Welcome to Vital Steps with Dr. Adler. This is the show that helps you feel strong, clear, and healthy.
It's good
no
to
matter
see you
your
again,
age.
Doctor.
Each week, we share simple advice that's backed by science and full of wisdom. We talk about food, movement, sleep, and everything in between.
Hey everyone, welcome back. Today's episode is a big one. We've got Dr. Adler with us, and we're diving into something that might just save a life. If you're over 65, there's one every day. Habit you might be doing in the bathroom that boosts your stroke risk by 300%. Sounds crazy? It's not. This is something millions of people do without a second thought, and it could turn dangerous fast. We're going to unpack the truth and explain what's really happening, so don't go anywhere. Dr. Adler, let's get right to it. I've read about people actually having strokes while just using the bathroom. That sounds crazy. Is that real?
It is absolutely real, and honestly, it's more common than most people realize. We don't usually talk about these things openly, but for many older adults, constipation and straining to poop are part of daily life. Unfortunately, that simple act of straining, especially while holding your breath, can cause a dangerous reaction in the body that raises stroke risk dramatically.
Wow. So let's slow that down. What exactly is going on in the body when someone's straining? Like that. I mean, why is it so dangerous?
Great question. So here's what's happening. When you sit on the toilet and start to push while holding your breath, that's called the Valsalva maneuver. It increases pressure inside your chest and stops blood from flowing freely to the heart for a moment. Then when you release, the blood rushes back in. This sudden surge can cause your blood pressure to shoot up, sometimes into stroke territory. In older adults, where the blood vessels are already more fragile or narrowed, this sudden pressure can cause a blood vessel in the brain to burst or get blocked. That's when a stroke happens.
That's terrifying. Are we talking about just a small risk here, or is it really that serious?
It's very serious. A major study from the Cardiovascular Institute of California followed over 15,000 seniors for 7 years, and the numbers shocked the medical world. People who strained while holding their breath during bowel movements had a stroke risk over 300% higher than those who didn't. Think about that. A threefold increase in the chance of having a stroke, just from something people do every day in the bathroom.
300%. That's not a small bump, that's massive.
Exactly. Another study out of Taiwan tracked 2,000 stroke patients and found that nearly 1 in 4 had their stroke on the toilet or just minutes afterward. That's how dangerous this can be, especially for anyone with high blood pressure or heart disease.
And I'm guessing this habit is really common, right? I mean, who hasn't pushed a little too hard? On the toilet now and then?
Absolutely. It's shockingly common. Nearly 89% of older adults say they strain during bowel movements at least once a week, most of them far more often. And that's not because they want to. It's usually because they're constipated, not hydrated enough, or not eating enough fiber. But the key issue is this. When they strain, they often hold their breath without even realizing it. That's the dangerous part.
It's like this silent habit nobody thinks about. You just go in, shut the door, and think it's no big deal. But it could end up being the worst moment of your life.
That's exactly right. And it's not just about stroke either. That sudden strain can cause your heart rhythm to go a little haywire. First, your heart rate drops, and then it jumps suddenly. That kind of rhythm change, especially in people with heart problems, can trigger arrhythmias. And those irregular heartbeats are a major risk factor for stroke, too.
Okay, so this is officially terrifying. But now, let's flip it. What should people do instead? If someone's sitting on the toilet and feels stuck, what's the smart move?
First, never force it. If you feel the need to strain, stop. Take a break. Stand up, walk around a bit, drink some water, and maybe come back later. One of the worst things you can do is sit there and push with all your might. That's where the pressure starts building and the danger kicks in.
And what about preventing this problem in the first place? I mean, nobody wants to be constipated.
Exactly. The best way to avoid straining is to avoid constipation, and that means a few things. Drink plenty of water throughout the day, eat more fiber, things like fruits, vegetables, and whole grains, and move your body regularly. Even just a short daily walk can help get your digestion moving. For some seniors, adding fiber supplements or using gentle stool softeners can help too, but those should always be used under a doctor's care, never on your own and never long-term.
So, Dr. Adler, let's say someone over 65 is listening to this right now. They've had a few moments on the toilet where they felt like they had to push hard. What should they do today?
They should start by drinking more water, right now. Then look at what they're eating. Are they getting enough fruits and vegetables? Are they eating oatmeal or whole grains? That's fiber. And are they moving enough each day? Even 10 minutes of light walking can help. And lastly, if constipation is a regular issue, they should absolutely talk to their doctor. Don't wait for something to go wrong.
It's wild to think that something as everyday as using the bathroom could turn into such a big health crisis.
And that's why we're doing this episode. Stroke doesn't wait. It doesn't send a warning. But knowing this one habit and stopping it can literally save lives. We just need to talk about it and help people take better care of themselves in ways they might not expect.
All right, guys, we're not done yet. There are 3 more everyday habits really common. Ones that are quietly raising stroke risk for seniors. You might not even realize you're doing them. Okay, I want to start with one I think everyone is guilty of: long, steamy hot showers. They feel amazing, right? Especially in the winter. But I read that they're actually risky. That can't be true, right?
Oh, it's true. And you're right. Hot showers feel incredible. They relax your muscles and make you feel clean and refreshed. But here's the catch. When that water is too hot, especially over 104 degrees Fahrenheit, it starts changing how your blood vessels behave. The heat makes them open up wide, which causes your blood pressure to drop quickly. And then, your heart has to work double time to keep your blood moving where it needs to go.
So, it's not just about comfort, it's actually messing with how your heart and blood flow work?
Exactly. For a younger person, that might not be a big deal, but for someone over 65, whose blood vessels are already less flexible, and maybe even narrowed from plaque buildup, this sudden change can trigger a stroke. Your body tries to adjust to the heat, but if your system's a little weaker or slower, it can lead to trouble fast.
Okay, but what kind of trouble are we talking about here? Like, how dangerous is this really?
A big study from the University of Tokyo followed 30,000 people over 20 years. And guess what? People who regularly took scalding hot baths or showers had a 26% higher risk of serious cardiovascular events, including strokes. That's a major number, especially when you consider how normal hot showers are.
And let me guess, long showers are even worse?
Yes, they are. The longer you stay in that heat, the more your blood pressure drops, and the harder your heart has to work to stabilize. That's why I recommend keeping showers short, no more than 10 minutes, and keeping the temperature warm, not hot. You can still feel clean and relaxed without boiling yourself.
Wow. So we're not saying cold showers, just not hot enough to steam up the whole house?
Exactly. Think safe, not scorching. If you need help with the temperature, use a shower thermometer. Stay under 100 degrees and ease into it slowly. Don't just blast your body with heat. And again, this is especially important for seniors who already have heart issues or circulation problems.
All right, let's move to the next one. And honestly, this one hit me hard. Sitting on the toilet too long, especially with your phone. I feel like this is everyone these.
It is. And that's part of the problem. What used to be a 2-minute bathroom break is now a 15-minute scroll session. And during that time, you're not just wasting time. You're putting pressure on your body in dangerous ways.
Days. Okay, so walk me through it. How does just sitting on the toilet actually become a health risk?
First, when you sit for a long time, especially if you're leaning forward with your head down, you slow down your circulation. Blood starts to pool in your legs and pelvis. That's bad news for seniors who already have slower blood flow and a higher risk of blood clots.
So, we're talking about clots forming just from sitting too long?
Exactly. When blood pools in the lower body, small clots can form. And if one of those clots breaks loose and travels up to the brain, it can block an artery and cause a stroke. This is how ischemic strokes often happen, and they're the most common type.
And I guess sitting in that hunched position makes it worse?
Definitely. When you bend forward and crane your neck to look at a phone, you can actually reduce blood flow to your brain slightly. Add in the pressure from sitting and possibly straining, and you've got a dangerous combo. Plus, the blue light from your phone messes with your body's natural rhythm. Your blood pressure and heart rate don't drop the way they're supposed to after a bathroom visit. It keeps your body in stress mode.
So now we got blood pooling, higher pressure, and a heart that's still on high alert all while scrolling TikTok?
That's right. And we've got hard numbers on this too. A large UK study looked at over 13,000 seniors. They found that people who spent more than 10 minutes on the toilet regularly had a 37% higher risk of heart problems and strokes. That's huge.
That's honestly scary. And it makes you think, because we've turned the bathroom into a second living room. Phones, magazines, podcasts.
Exactly. But the bathroom isn't the place to relax. It's a place to take care of business and move on. Staying in there too long, especially with your body in that bad position, is just not worth the risk.
All right, so what should people do? Especially folks who are kind of used to taking their time in. There?
First, keep it short. Try to stay under 5 to 7 minutes. Don't bring the phone with you. If you feel tempted, leave it in another room. Focus on staying regular by drinking enough water and eating fiber so you don't feel the need to sit and wait. And if you must be there for a few minutes, stand up and stretch your legs right after. That helps keep the blood moving.
I never thought I'd say this, but the toilet might be the most dangerous seat in a house.
If you're over 65 and have high blood pressure or any heart problems, it absolutely can be. But the good news is it's totally fixable. You just need to change your habits. Warm, not hot showers, short bathroom visits, no phone scrolling on the toilet. These small changes can protect your heart and your brain in big ways.
Now, we've already covered some surprising stroke risks in the bathroom: straining too hard, sitting too long, even taking super hot showers. But get ready for this one, because this habit might be the sneakiest of them all. It's something we all do, multiple times a day, and it can lead straight to the hospital if we're not careful. So, Dr. Adler, today we're talking about standing up too fast?
Yes, and I know it sounds simple, right? But for older adults, especially folks over 65, getting up too quickly after sitting or lying down can be very risky. It's more than just a dizzy spell. It's something that can mess with your blood pressure, damage your arteries, and even lead to a stroke.
Okay, now I need you to explain this one, because I've definitely stood up and felt a little lightheaded before, but I always just brushed it off like, oh, I moved too quickly, are you? Saying that's actually dangerous?
Exactly. That feeling of being lightheaded, seeing stars, or needing to grab something to stay balanced, that's your body struggling to get blood to your brain fast enough. It's called orthostatic hypotension, and it happens when your blood pressure drops suddenly after you stand up. Your heart and vessels are supposed to react instantly to push blood upward, but in seniors, that response slows down.
So, let me get this straight. When someone older gets up too quickly, their blood pressure can crash and then not recover fast enough?
That's right.
And when that blood pressure drops, less blood and less oxygen reaches the brain. That's when you feel dizzy or unsteady. For some people, they might even faint. But here's where it gets really dangerous. These sudden drops in pressure and blood flow can actually damage the inner lining of your arteries. Over time, this makes those vessels more likely to clot, or worse.
Burst? As in brain bleed?
A burst blood vessel in the brain is called a hemorrhagic stroke, and it's one of the deadliest kinds. Now, most people think a stroke just happens out of nowhere, but we now know these small, repeated episodes of pressure crashing and surging can wear down the body until one day something gives.
And how common is this for seniors?
Very common. In fact, studies from the Cleveland Clinic show that older adults who often have this blood pressure drop when standing are up to 40% more likely to suffer a stroke or heart attack. That's not a small number. That's almost half.
Wow. And I'm guessing it's not just the stroke risk. If someone gets dizzy and falls in the bathroom, that's a whole different kind of emergency too, right?
Absolutely. The CDC reports that about 80% of bathroom falls happen to people over age 65. And these aren't just little slips. We're talking about head injuries, broken hips, and even bleeding in the brain, which again can lead to a secondary stroke. The risk is even higher if the person is alone and can't get help quickly.
That's terrifying. And honestly, this feels like one of those things that's super easy to overlook. People are in a rush. They're tired. They're trying to get up and go. But what's actually happening inside the body during that moment?
When you go from sitting or lying to standing, gravity pulls your blood down towards your legs. Your body is supposed to react by tightening blood vessels and speeding up your heart to push blood back up to your brain. But with age, blood vessels get stiffer, and that reaction slows down. Add in things like medications, especially blood pressure pills, and it gets even worse.
So we've got slower circulation, aging blood vessels, maybe some heart issues, and then we stand up too fast and throw the whole system off?
Exactly. It creates a dangerous storm inside your body. And remember, most seniors already have a bit of plaque built up in their arteries. If blood flow suddenly drops and then surges, it can shake a piece of that plaque loose. That's how clots form. And once that clot travels to the brain, that's an ischemic stroke, the most common kind.
Okay, so I'm officially never standing up fast again. But what should people actually do to stay safe?
It starts with slowing down. That's the golden rule. When you're sitting on the couch or lying in bed, don't just jump up. Pause for a few seconds. Sit on the edge of the bed. Take a couple of deep breaths. Then slowly rise, making sure your feet are planted and your balance feels steady. It only takes 10 extra seconds, but those 10 seconds can save your brain.
And what about after getting off the toilet or out of the tub? Those feel like tricky spots, too.
Those are actually the most dangerous moments. After a warm bath or shower, your blood vessels are already more relaxed from the heat. Then if you stand up fast, the pressure can drop like a rock. I always tell seniors, hold on to something. Whether it's a grab bar, a counter, or even the wall. Rise gently, take a moment to feel steady, and then walk. No rushing.
Now I have to ask, what if someone is always feeling dizzy when they stand up? Like it's not. Just once in a while.
That's when you need to talk to your doctor. Frequent dizziness on standing could be a sign of something deeper. Maybe your medications need adjusting or your heart isn't pumping strong enough. In some cases, doctors might recommend compression socks to help keep blood from pooling in the legs. Or they might check for dehydration, which is a common cause of low blood pressure in seniors.
It's wild how something so simple, just standing up, can be so risky if we don't do it right.
That's the thing. Stroke risk isn't just about big, scary symptoms. It's about these tiny, repeated stresses on the body. A little pressure here, a little dizziness there, over time. It builds up. But when we're aware of the risks, we can stop the damage before it starts.
Well, you've heard it here, folks. The best way to stay standing is to stop rushing when you stand. Small changes save lives. And we're going to keep talking about them right here on this podcast. Thanks, Dr. Adler, for always telling it like it is. If you found this helpful, don't forget to like, follow, and subscribe. And hey, share it with someone you care about because these tips might save a life.